So the skills session we're going to cover today is the application of eye drops for the patient. So the first thing we're going to make sure we have is our equipment. So we have hand sanitizer, we have our eye drops, we have the appropriate sized non-sterile gloves, we have normal saline, and we have low linting swabs. The next thing we're going to do is we're going to discuss the procedure with the patient and to gain their consent. And this is very important so that they understand what to expect and the procedure that's going to be undertaken. The next thing we're going to do is we're going to check the prescription sheet. So we're going to make sure that we have the correct patient, that we're going to use the correct drug, that we have the correct dose, that it's the correct date and time, the correct route and method, the validity of the prescription, the signature of the prescriber, and that the prescription is overall legible. The next thing we're going to do is, if the patient is in the sitting position, we're going to make sure that they're sitting with their neck slightly hyperextended. Alternatively, the patient may be lying down. If there is any crusting or drainage present around the eye area, we'll make sure to clean the area, starting from the inner to the outer canthus. So we'll start by attending to our hand hygiene first. And then we'll apply our appropriately sized non-sterile gloves. We're going to dip the swab into the normal saline. And we're going to take our drops as well. We're going to ask the patient at this stage to look towards the ceiling, and with the wet swab, we're just going to pull down the lower lid. We're going to apply the drops as prescribed. That may be 1 or 2 drops. And we're going to apply them from approximately a height of 1 to 2 centimeters. We're going to ask the patient then to close their eyes for 1 to 2 minutes, and we tell them to expect some blurred vision which can occur after the application of the drops. After the procedure is completed, we remove our gloves, remove any waste, and apply our hand hygiene again.